Good evening, everybody. My name is Lori Orestano James. I'm the president of the Monticello Central School District Board of Education. We'd like to welcome you to the public session of our meeting this evening on March 18th, 2021. I'd like to remind everybody that this meeting is being recorded. We do have a public comment section of our meeting in which we are asking if you'd like to be heard, that you send an email to comments@k12mcsd.net, and we will read what we are able to see into the record. And again, we do know that some of you are watching at a different time. You may not be with us live right now on Thursday evening. And if you see this recording and you have a desire to ask questions, you can send information at that time as well. And those emails will be answered and information put out to the public. As you will see in our documents tonight, we have a few things that we could not answer at our last meeting, and therefore it was answered publicly by putting that into our public comment section. With that said, I'd like to entertain a motion to come out of executive session made by Mr. Crumley, seconded by Ms. Greco. Any discussion? All in favor? Any opposed? So ordered. With that said, I ask everybody please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. I'd like to remind everybody to please turn off all your electronic devices, not the one that you're on, obviously, but anything that could be disturbing the meeting. And I'll entertain a motion to move the agenda to the table made by Mr. Crumley, seconded by Ms. Weiner. Any discussion? All in favor? Any opposed? So ordered. Dr. Evans, any additions, deletions, or corrections to tonight's agenda?
Yes, Madam President, I have one item to add. This would be item K4. It would be a termination, and it would read, "Be it resolved that upon the recommendation of the Superintendent of Schools, the Board of Education approve the termination of employee number 02491 effective March 18th, 2021.
Okay, thank you very much. I'll entertain a motion to adopt the agenda as amended, made by Ms. Greco, seconded by Ms. Holmes. Any discussion? All in favor? Any opposed? So ordered. Thank you. I'll entertain a motion for approval of minutes of March 4th, 2021. Motion made by Ms. Sharoff, seconded by Ms. Galligan. Any discussion? All in favor? Any opposed? So ordered. Student board member update, one of our favorite times of our meeting, Kayla Colon.
Hi, there's a couple of things. The first being that we just completed our SUNY application week, and a lot of seniors are being supported in the entire application process. Progress reports are being sent out this week. Musical tickets are on the website. They're able for purchasing. The musical is tomorrow and Saturday. Spirit Week is this upcoming week, which is really exciting. Monday is Blue and White. Tuesday is Crazy Hat and Crazy Hair. Wednesday is Favorite Sports Team. Thursday is kind of a beach/pet day. And Friday is our annual Color Wars like we always have. All of the information is on the bulletin board for students and teachers. And lastly, this month is Athletic Training Appreciation Month, and we have an athletic trainer. I would just like to shout her out. Sarah Sheridan, she is our athletic trainer. We are the only district in the county that has an athletic trainer. So Monty Strong.
Thank you very much, Kayla. I just want to clarify, Kayla, the tickets for the musical it technically is a purchase. You have to go on and get the tickets so that you get the link at the time, but there is no cost. Am I correct?
Absolutely, yes.
Okay. So anybody who'd like to see it, certainly go on, and you can get, they ask that you, because I've already got my tickets. They ask that you go on and you do like one per household because it's harder to view otherwise with the system they use. But go in and get for either one of those nights. Thank you, Kayla. Any questions of Kayla? thank you as always for your positive spirit. It's always wonderful to have you here and light up our lives. Thank you.
Thank you.
Moving on from there, I will turn it over to Dr. Evans for our budget presentation for this evening.
Thank you, Ms. Oristano James, and well said, Kayla. Looking forward to the musical tomorrow night. Tonight will be the final installment of our program budget presentations. The board has previously seen presentations from our operations, technology, security. They've also seen presentations from our principals on their proposed budgets for next year. Kind of wrapping things up relative to program tonight will be curriculum and instruction, pupil personnel services, and special programs, and BOCES. So I will turn this over to Ms. Fela, who will introduce our guest administrators tonight for their presentations.
Thank you, Dr. Evans. Ms. Montez, can you bring up the presentation on the screen? Thank you. Like Dr. Evans said, tonight is curriculum and staff development, pupil personnel, special programs, and BOCES. Next slide. So at our budget meetings, by law, the board makes the final decision on the budget being presented to the public for voter approval. We do solicit input. You can use the comments at k12mcsd.net to ask questions. Our goal is to be as transparent as possible. Everyone will be heard and respected, and please comment in context. Next slide. So the first section of our budget presentation tonight is curriculum and staff development, and that will be presented by Dr. Oler Marks.
Thank you very much, Ms. Fela. So for me and for pupil personnel and special programs that follow after, just to kind of couch it with an umbrella statement, we obviously have all combed our budgets in looking for areas where we can save money, but due to COVID, there are certain, and the year that we've had, there are certain areas where we had to have increases, and we'll each talk about those separately with the rationale behind that. So you can see from the curriculum and staff development budget that there are areas where we have been able to find significant decreases. In some places, you will see, however, that there's one area where we have had, we've asked for an increase with conferences and training, and this is due to increased training needs around reacting and responding to the educational needs of the students. And then you can see in 2 of the budget codes that we have significant decreases, and that's because we reassigned some of those program costs to the BOCES budget because that's where they are more appropriate. That is it for me.
Next slide. So the next section of the budget is our PPS budget, and Ms. Duryea will be presenting that.
Good evening, Board of Education members, Dr. Evans, Dr. Oler-Marks, Mrs. Fela, student board member Kayla, good evening, and to my colleagues, and of course, Ms. Montez, good evening. It would behoove me not to thank Ms. Fela and Ms. Christine Rice for providing me with data and preparing this budget. They did a great job in giving me line-by-line comparisons from 2017 to December of 2020, so I could be as deliberate and accurate as possible and try to contain costs in certain lines. And I feel I did that indeed in the budget that I put before you. You will see there are 3 lines particularly that increased quite dramatically. And, with the increases in special ed, children with more significant needs require more significant services. And with that comes a cost. The first line that you'll see the increase in is contractual tutorial hospital services. I did increase that by 25%. This year, unfortunately, with medical and social factors, we have more students in the hospital. And when I say in the hospital, I mean requiring psychiatric supportive services, whether it's in Four Winds, Columbia Presbyterian. And what we've seen differently this year is some students stay anywhere between 14 days and 30 days max, but often we're finding many of our students having to return. because they aren't coming in for that full-time direct support and receiving social worker services, guidance counselor services, relationships with their teachers. So that you will see that line increase by 25%. The next big increase that you'll see in my budget is contractual occupational therapy services. Monticello School District has a private contract with Pro Therapy, and we put an RFP out several years ago as per the board's directive. Lisa, thank you again for that. And due to when the pandemic struck in March, due to COVID, usually we have Committee on Preschool Special Education students who transfer in to CSC services. And many times those students are discharged from related services. And that did not happen this year. There was limited flexibility in terms of the regulations and compliance when it came to state as well as federal regulations in terms of special education. So what the district did, Monticello and many other districts, we maintained services and we did not discharge. And they were providing teletherapy. So the projected decrease in services did not occur, and those children came in kindergarten, more students requiring OT services, as well as our school-aged students aged 5 to 21, some of those students who would have been discharged because the whole goal of special education services is to remediate and then discharge the service. So we did not, our students didn't progress and accelerate due to that non-direct therapy contact with our providers. So what we did was, with the help of Ms. Fela, we amended our contract with Pro Therapy, and we went from having 2.5 to 3.3 OT providers, which provided us really with 4 additional days of the week of OT services for our students, so we can provide the mandated OT needs for our students. The third line that you will see greatly increased in my budget is the tuition for CSC private placements. That increase is approximately $325,000. And there's several reasons for that. The first reason is, as I said, there's limited flexibility. We have Sullivan County Division of Health Services increased its maintenance fees for our students who are in residential placement from 32% to 56%. And I want to make it very clear, this is not Sullivan County doing this. This is a formula that is used through state education for every county in New York State. So I just want to go on the record that this is not, I believe, Sullivan County doing this. Another is we have more students who are requiring a residential setting in private placements. Special education costs could shoot up very quickly, or they can shoot down very quickly. I try to work closely with the business office to create the most realistic, fiscally responsible forecast that I can. The second slide, Janet, you can go to the second slide, please. You'll see with the second slide, there's no real statistically significant changes in the budget that I've proposed, perhaps some, minimal decreases in just trying to, budget smartly.
Thank you, Ms. Duryea. Next slide. This next slide is for summer school and special programs, and Ms. Taylor will be presenting this budget.
Thank you. Good evening, everyone. Thank you for the opportunity to be here tonight. The proposed 21-22 special programs budget has an overall decrease of $5,000 for a total of $62,000. Our summer school line items remain the same for a total of $9,000. In contractual expenses, there is a decrease of $4,500, bringing that total line item down from $40,500 to $36,000. My mileage expenses are being proposed at $1,000, down from $2,500. $5,000 in conference expenses have been eliminated completely, and $6,000 of reallocated funds from the mileage and contractual expenses account for the increase in supplies that you'll see to support the expansion of K-12 Tier 1 SEL resources.
Thank you. Next slide. This is the BOCES budget. Oh, go back. This is the BOCES budget for the upcoming school year, and I will present that. The couple of areas with a significant increase, we have the central business office is going up $12,600. This is based on historical increases. The CBO will cost us about $330,000 for this current school year, 2021. That's up $10,000 from 1920. And from 1819 to 1920, it also increased $12,600. So I was confident that it's probably going to go up $12,600. An area that decreased was our HVAC tech. We invested some time in one of our current employees to get his certification to be an HVAC tech. So we reduced the service from BOCES to 1 day a week. The BOCES administrative charges, BOCES gave us a rate increase of 5.86%, and that's reflected there, or a total of $35,450. The debt service line also includes capital and rental for the BOCES. The rental portion of their budget is only going to increase 3.65%, but their capital portion is increasing 21.77%. So you'll see that increase of $40,000 there. There was no increase in staff development. We pretty much, that's what we spend year after year, $45,000. Regular school is made up of several COSERs, but the most significant increases in those COSERs are CTE. That's an increase of $50,000. That's a combination of tuition increases and number of seats. Alternative ed is also going up $20,000. Spark and IDT, which are intensive day treatment programs, that's going up about $25,000. School improvement is in this line. That's increase of $240,000, and that's the reallocation from the curriculum and instruction budget. There's decreases also in the BOCES regular school. We have shared technicians. That's a decrease of $70,000. Orange Ulster, we had a shared technician and they chose not to replace that person. Communications is down $15,000 as we reduced to 1 day a week. Tech support also is a decrease of $95,000 because in 2021, we increased that line to purchase additional iPads and laptops. Special education, there's increased costs there for several COSERs, and most of them are in double-digit percentages. COSER 201 is a 17.44% increase. COSER 206 is a 4.64% increase. ITAP is a 14.81% increase, and 207 is an 8.66% increase. The related services in special education, those increases range from a low of 1.99% to a high of 10%. So all of those things together is about a $280,000 increase in costs. Library automation is a slight increase, and tech integration has a slight decrease. Next. So this is our general information page. We have the board petitions are due April 19th. The board adopts the budget on the 20th. The budget's made available to the public on the 29th of April. We have our budget hearing on May 6th, voter registration day on May 11th. We mail our budget notice on May 12th, and the budget vote is May 18th. In our upcoming board meetings, our next board meeting, the topics will be instructional and support staffing, benefits, and district-wide expenses. We'll also probably have a final state aid, I'm hoping, and we'll have an estimate of what the final budget will be. And then on April 20th, we will have the final budget presentation to the board and budget adoption. That's it. Thank you.
Thank you, Ms. Fela, and thank you, everyone. Well done.
Thank you, Ms. Fela, and everybody else from the board. Any questions at this time? Remember, we still have time to digest the information being given and utilize that information in a future budget meeting. Ms. Jersey.
Just a couple of them. So on the pupil personnel services, the contractual tutorial for the hospital, is we provide additional services, or these teachers and stuff that are currently in the school district, we have to pay extra?
That's a great question. So when they're in the hospital, they're staying in the hospital in treatment. And legally, state law says elementary students must receive 5 hours per week of educational support, and middle school and high school must receive 10 hours. And these hospital settings hire certified teachers. Usually, Ms. Jersey, it's through an agency that provides state ed certificated teachers. And those, we get notice from the hospital that we have a student there. We connect them with the guidance counselor. We try to email the work down we never want a breakage in the continuation of curriculum and instruction for that student. So we do continue to provide the work, but they provide the direct instruction down there. Did I answer?
Yeah, that's great. The other thing is the occupational therapy. So do we know any idea of the percentage of children that are doing this as teletherapy, and are they actually remoting in to do it, or are they doing it in person?
The majority of our special education students, and I'm really so proud of Monticello School District. I said this in a principals meeting the other day. I said we were really the last to close it, and hopefully we're going to be, the first to really. Actually, we did have a lot of our special education students. So, kudos to the central office, to our special education teachers, went above and beyond to move furniture out of their classrooms. So the majority of our special education teachers, students, have been offered to come in 4 days a week quite a while ago. Those parents and families who have opted for fully remote, they're doing the teletherapy. So all of our services, whether it's OT, PT, speech, if the students are in school, it's direct instruction. If they opted to be home for remote because of their situation, they're participating in teletherapy. And I know that the majority, I collect attendance from all of our special education teachers. They've been wonderful. All of our related service professionals, because they're mandated legal services and we have to project for budget compensatory services, they send me their attendance every month. So I can see, I don't have that number exactly for you, but I will tell you, if they are in school, they are getting direct services, and the majority of our special education students are in school.
I was just wondering, because I know kids can't log on a lot, and it's very hard to do those types of services versus doing teletherapy. So I didn't know what percentage of students are actually partaking in that.
Right, and you are absolutely correct, and that's a great point. And also with the teletherapy, is certainly not as effective. And I've been telling parents a lot of annual review meetings and CSE meetings that don't be alarmed if you see our related service providers making a recommendation for the goal to be carried over into the next IEP, because it's skill-based and you're not going to see the same rate of progress with the teletherapy. And then also those barriers of logging in.
Any other questions from the board? Okay, thank you. You are all more than welcome to stay. It's just, I have to tell you, the Brady Bunch enlarged is very difficult to try and see where my board members are as you keep moving in Zoom world. But certainly you can, sign on the other side if you'd like, but you're certainly welcome to stay. We appreciate you coming this evening and presenting to us. We say go enjoy the rainstorm outside, I guess. So thank you so much for being here with us this evening.
Good night.
Good night. And with that said, Mr. Crumley.
Madam President, I move that we accept the consent agenda F1 through M2 as a group.
You want to accept them as a group, and I need a second on that, made by Ms. Doherty. Any discussion? All in favor? Any opposed? So ordered. I'm sorry, I'm scrolling all the way down. Board roundtable. Does anyone have anything out to report? Okay, just want to share that I did attend the Wellness Committee meeting yesterday. A lot of good work is going on there. Certainly in each of the schools, we appreciate what's going on. Focus still around a number of different issues, inclusive of concern regarding COVID coming out of whatever this is going to look like, which we don't know yet, obviously. But that committee has been working diligently in planning and making sure that our students and our families have support services. If you have not signed on, this is a message from the Wellness Committee to report out to you, is that if you have not signed on for any of the EPIC episodes that have been going on, they're extremely well received. And there's a lot of good work going on. So we thank Jane Sorensen for her work with regard to that. And the second thing that we wanted to make sure people were aware of is that at the Crawford Library this evening, the NAACP, along with the Crawford Library, is working along with public health nursing with regard to educating families and members on the COVID vaccines, the different types, the concerns around it, et cetera. There's medical people who are on that. Obviously, we're on this call, so we can't be there, and people who are watching live obviously can't be there. So it is going to be sent out as a link. I just don't know when we're going to receive the link for school districts to be able to put up onto their website for parents to access. And it will also be available. I know on WJFF, I do not know. I believe it's the station that Hank Gross also does news for, and I just don't remember which station that is the other one that is coming out. So, just take a look for that if you have questions around the COVID vaccine, concerns about getting it, not getting it, et cetera, for families, et cetera. So that is coming out. So that is what I've got to report. We have tonight, we've got our information reports and discussions are around our directors. Does anyone have any comments or concerns with regard to anything that was in any of those? Okay. Generally, I like to do a little highlight from each, just to, give a shout out to our folks at the last meeting, because we ran late with executive, and this week we ran late with executive. I won't go there, but I do want to do one fast shout out that's here, and that's to Mr. Budenhagen. We thank you within that report. You thank the board, and you thanked a whole bunch of people around what it is that we've been able to get done under the circumstances of what the regulations have been coming down from the State Department of Health with regard to our athletics and things of that nature. We want to thank you and all the coaches for the work that you did. We know that it was not easy to get what we could get done, and we appreciate all the work that you did as our athletic director. So thank you. Moving on from there, policy committee memos. Dr. Evans, we're good right now, correct?
We're good right now. No action at the moment.
Okay. Correspondence outcomes. So again, I just want to remind folks who are listening, correspondence questions, sometimes we can answer them right away. Sometimes we need to get information to be able to correctly answer you. So in order to be able to give you the best information possible, the things that were not able to be answered in the last meeting they're available for correspondence outcomes, so you can see what those answers were to those questions that were posed. Capital project update, Dr. Evans.
Yes, thank you, Ms. Oristano-James. Good evening, everyone. A few things on our capital project as it moves forward. If one drives by our transportation center and campuses on Route 42, you'll see the new transportation center frame has been erected, and we're now awaiting for the walls and other fittings to be coming in. Those are supposed to be coming in before the end of this month. So progress now is picking up quite a bit there. On the other hand, unfortunately, at the high school, as was discussed at the last board meeting, because of the redesign that was forced to happen because of the interesting workmanship done on the original construction of the building, you heard our architect talk about some of the delays in that process. We received another small setback in that as our contractors began to work on the roof to put in more, punctures in to put more air handler units on the new roof, we discovered some unanticipated asbestos. So that will require a stoppage, if you will, while that asbestos is abated, and then that can resume. Right now, we, as you heard at the last board meeting, we are bracing for a delayed opening of that new wing, possibly in the range of 6 weeks to 8 weeks. We have, however, had a number of conversations with CPL, our architects, LaChase, our construction managers, to really urge them to expedite the process as safely as possible. And we are trying to work with them so that parts of that new wing are opened as they become available. So it wouldn't be one grand opening of the entire wing, but as spaces of it became safe for student and staff occupation, that we opened them. We did stress the need for space at the high school next year, as we don't know, as of right now, how things are going to, what requirements are going to be in place relative to COVID next year. So I'll keep you updated on that as we progress. The change order that was approved at the last board meeting has been submitted to State Ed, and we are waiting for them to act on it. And our architects, CPL, are currently drafting the final plans, design plans, for the new tennis courts, which is the next phase in the project. Those should be going up to State Ed probably within the next week. So that's the next step in the process. And that's the latest on our capital project. Any questions?
Seeing none from the board, we're going to move on to the path forward. Dr. Evans?
Yes, thank you again. So we've been working rather furiously. I just need to share my screen, Janet, if I may, over the past several weeks, and in particular, since our last meeting, to try to develop some surefire strategies and program improvements that will improve what we're offering our students. So just very briefly, what some of those look like today, and our staff and community will be receiving updates as soon as tomorrow morning and throughout the next several weeks on what these look like. So first and foremost, just to give context, because there is a bit of a disturbing trend happening here in Sullivan County, as in other places in the Northeast, and that is we are starting to see an increase in COVID-19 cases. I say this just to give some context. This is not an excuse. This is not it can be a setback of sorts from time to time. Tuesday morning, we had a high-level principals and directors meeting, and we started to get into the kind of nuts and bolts and nitty-gritty about what we wanted to do. And suddenly, Dr. Olermarks and Mr. Wilder were called away because we had a confirmed COVID positive case at the high school. This has been a relatively frequent interruption process for our administrative team as we work throughout this year. So we labor on, we continue, but what we do need to be mindful of is that according to the last CDC guidance that came out in mid-February, the number of cases per 100,000 residents in Sullivan County is now 216 over the past 7 days. Over the past 7 days, there's been 163 total new positive cases in our county out of approximately 3,100 tested. That's a 7-day positivity rate of 5.2%. To give you context about, well, what did that look like compared to the last year? It's lower than what it was last April for sure. It's much higher than what it was last summer and September when we reopened our schools. It's about where we were as a county in early December. So it has kind of stabilized right around that 5% mark. And what that means, if we are to use CDC indicators, is that we are here in this high transmission red zone because we have total new cases per 100,000 persons in the past 7 days. It was 216, so it's over 100. What that means, using what the CDC is recommending as of today, I'll come back to that in a moment. What they are recommending, and this is not regulation, this is guidance, is that elementary schools should be in hybrid learning mode or some reduced attendance, that students and staff are to maintain physical distancing of 6 feet or more, that middle and high schools should be in virtual only instruction unless they can strictly implement all mitigation strategy and have few cases. However, schools that are already open for in-person instruction can remain open, but only if they strictly implement mitigation strategies and have few cases. We believe we fit into that category. And lastly, sports and extracurricular activities are virtual only. Keep in mind, though, that the State Department of Health and the New York State Education Department ultimately have the regulatory authority over us. Now, it has been reported that the CDC is seriously considering reducing that 6 feet of social distancing down to 3 feet in schools. It was also reported late this afternoon by CNN that CDC will be issuing that revised guidance tomorrow. Should we receive that revised guidance, the first thing that we will do is review that revised guidance carefully to see exactly what it says and allows schools to do. And then immediately after that, we will begin remeasuring our classrooms if it is reduced to 3 feet. So that could have a significant change. However, there are other factors that would play into any type of expanded reopening. However, even with 6 feet of social distancing, we believe that we can, and we have been planning to make what I'm calling as of tonight, tentative April adjustments. And I say tentative because many of these things we can do, we have done, and we are ready to expand upon. However, the big one, which I've highlighted here, there is much to be determined yet on this. And a lot of this first piece. So what you see here are 2 columns. The first is, what are our strategies for expanding in-person enrollment and offerings? And then beginning on April 14th, we will begin having in-person student offerings 5 days a week, meaning we will begin bringing back students on Wednesdays in a limited fashion at first. So first, to talk about the Wednesdays, what we are planning to do on April 14th is bring in targeted in-person interventions for students who have been identified as at risk at their schools. Those are school specific. They are nuanced and specific to each school based on who they've identified. At the moment, we do not plan on having cohorts A, B, and C in on Wednesdays. However, that could be happening later in the spring if all goes well and according to plan. But what we are beginning with on April 14th is students coming back in on Wednesdays for some targeted interventions. Schools will be reaching out and contacting those students eligible. Now, in terms of general expansions of in-person enrollment and opportunities, we are tentatively planning, and I guess a better word might be exploring, the interest in and possibilities of, at the elementary level, eliminating the hybrid models, meaning cohorts A and B. Those are the cohorts that meet 2 days in person and then 3 days remote, and they alternate. And then putting it to parents to opt in for either cohort C, which would be 4 days in-person attendance 4 days a week, in-person instruction 4 days a week, or cohort D, which would be remote instruction 5 days a week. So the stage that we're at now is that principals have begun discussions with in their pandemic planning committees. And we will be having discussions with our union leaders over the next week and other staff leaders to figure this out. There are a number of moving parts here, including available personnel, available space, impacts on transportation. So I'm really highlighting this as being tentative right now because there are a number of things that still need to be resolved. However, we think we can do it. And we are certainly confident in that if the social distancing is reduced to 3 feet. Now, a number of questions have arisen regarding the use of partitions. At this time, I cannot recommend in good faith that partitions would be a wise use of district resources as a short-term expense. And what I mean by that is a neighboring district priced out approximately 1,300 partitions. These are polycarbonate clear partitions that would go around a student's desk or a student would take with him or her throughout the day, 1,300 of them for $25,000. And they would have to be cleaned either every time a student uses them, if they're given to another student, or daily. What we are looking at instead, and we've begun discussions about, and a lot of this depends on whether the social distancing goes from 6 feet to 3 feet, is potentially the use of polycarbonate face masks, face shields. because those with a face covering, the cloth mask, would allow for more student involvement, and they would be much cheaper, less expensive than what those partitions would be. But that's all very tentative at this point. I think right now what we're looking at with what you see here is maximizing the space at 6 feet of distancing, or if it is reduced to 3 feet, we would begin remeasuring right away. But there's still a lot that has to happen for this first highlighted piece to come through. Now, in other places where we are ready to move forward with expanded in-person enrollment, the middle school has been steadily increasing their in-person enrollment. I walked through the building today and I saw a good number of students in and attending in person. What they've created are what they're calling supervision spaces. So in other words, today was a Thursday. Cohort A students would normally be home on remote instruction, but what the middle school administration has created are supervision spaces where those remote instruction students can opt to come in on Thursdays and Fridays as well. They're supervised by a paraprofessional. It's not direct teacher instruction. However, they are in school with a paraprofessional who can provide some level of instruction, and teachers and other staff are visiting them while they're in these supervision spaces. So what that means is a good number of middle school students are currently able to attend 4 days a week, even as we speak. At the high school, they are very close to finalizing plans that they believe they can get off the ground by April 19th, which would include the following: increasing more students in cohort C, which is 4 days a week, and also increasing in-person direct instruction for identified at-risk students in 9th and 12th grades who currently are not in in-person settings. All of these, whether they're at the elementary level or the middle school or the high school, will be coming out directly through those administrations. However, we believe very strongly that we can pull through on these. And if social distancing is reduced from 6 feet to 3 feet, that would certainly enable the process a great deal. It might cause a minor delay as we remeasure. However, we are very confident on starting Wednesday's in-person offerings on April 14th. And we believe we can pull off the expanding in-person enrollment for the elementary levels. The middle school is already in place and the high school is almost ready to go with this. And we expect that to happen as well. So one last thing before I take the board's questions on this, you might have read in today's paper that Monticello Central School District will be receiving approximately $10.2 million in federal stimulus money. That money can be expended as soon as we receive it, up through, I believe, September 30th of 2023, but don't hold me to that date. I'd have to do a little more digging. What we don't know yet is whether or not that's an accurate disbursement total, because the state education department will ultimately be dispersing it. We don't know what the stipulations are that go along with that. In other words, how we can utilize those funds. And they haven't been dispersed yet. And I bring that up because just a couple weeks ago, in March of this month, we received our first disbursements of the initial CARES Act funding that was approved by the federal government in June of last year. So yes, we can make plans. Yes, we can make some tentative purchases. But any purchases that we make right now, if we don't have that money, we have to be prepared to pay with it out of our general fund, which we believe we can do. But just know that we're not expecting a $10 million check from Uncle Sam on Monday morning. Okay. All right. So let me, any questions that the board has regarding my presentation on where we're going? The next steps will be at the elementary level. Over the next few days, we will be getting an interest survey out. It's a non-committal, non-binding survey. It's just surveying parents that if the cohort C or cohort D were the only options, which one would you select? We need that information to plan our spaces and personnel accordingly. I will be putting out a community letter tomorrow that explains this in a little bit greater detail, though it won't be as colorful. It'll be a web post. But that's where we are today. And I do want to give a lot of credit to Dr. Oler Marks, Ms. Fela, and our administrative team who have been working very diligently around this. Any questions from the board?
Any questions? Helen, Ms. Jersey.
On the high school Part B,
Mhm.
is that just for at-risk or is that for all 9th and 12th graders?
Linda, you spoke with Mr. Wilder today. Do you want to?
Yeah, so we are looking to get all 9th and 12th graders who would like to come in to be able to come in.
But they would have live instruction, or they're just going to come in like they did before?
No, live instruction.
Live, direct, in-person instruction.
Yes.
Okay.
Yep.
Any other questions? Okay. On behalf of the board, we'd like to thank you. We do know that this has been a very trying time, and every 2 minutes they're changing what the requirements are coming from on high, and what you have to do, what you can't do, et cetera, et cetera. And we know that you guys have been diligently between working on planning, working on running the district on its daily operations, but also when you have to, deal with different buildings having to shut down, and the responsibilities put upon the school districts to do those concerns with regard to, how do you deal with those contact tracings and the time and the energy involved in that. We appreciate, on behalf of this board, on behalf of the people of our community, on behalf of our students, we thank you for your time, your effort. We know that you have been going above and beyond board, so we do appreciate that. With that said, moving on, upcoming events. Kayla, I'll read your question in a second. I'm sorry, it dropped before I got to see it, so give me a second and I'll take a look at it. So upcoming events, you can see the schedule there. Community events are there. Kayla, I'm going to quickly take a look before we go into the other. Are there any updates about that SurveyMonkey or Committee for Board of Education Awards for sports? We are in the process of putting that together, Kayla, so that will be coming out shortly. Okay, did you hear me, Kayla? I know sometimes you freeze. Yeah, good?
Yeah,
Okay.
my audio is just really weird.
Okay, thank you. And you will definitely be aware of that, so when it comes out officially. Moving on to questions and comments from the public. We do have some that have come in, so I'm going to take them now. Some people wrote multiple times. I'm going to just read one into the other. When we go there, I just want to remind people for the policy of the district, Board of Education recognizes the value of public comment on educational issues and matters of public interest. In order to permit a fair and orderly expression of public comment, the following rules shall govern and will be administered by the presiding officers. Please note that the first public comment period of 45 minutes maximum duration will be at the beginning of the meeting, and the period of 15 minutes maximum at the end of the meeting. Either period may be extended by a majority vote of the board. Neither public comment period is a time for public discussion. If necessary, the community members will be contacted for follow-ups. If you wish to speak, place your name on the list, email, etc. So in this case, we will be using that, as I said the last time, please make sure that your name is there if your email does not represent your name, so that we have that information. Prior to making comments, we'll state the name for the record. We will identify if they are with any group or organization being represented. Comments are limited to 3 minutes or less per speaker. A speaker may not yield his time to another speaker in order to extend the time for comments. No speaker may comment or identify any particular student or employee by name, position, or situation in his or her comments. All comments are to be directed to the board president designee. Handouts or anything would come directly, and again, same thing through that email situation. So with that said, I'm going to take a swig of water. And I will start to read. So thank you, Janet, again for uploading for me. I appreciate that. This is a question in a series of questions, so I'm going to have to pop in between the screens to do this. This is from Anne Marie Laux. She's asking, how come our district has no plans for reopening while other districts are set to reopen after Easter? Dr. Evans, I don't know if you want to address that any further. I feel you just did in the presentation you did. So if you want to maybe reach out regarding that, let me continue on because she had some other questions that are listed here as well, so I can get them all out. The next one is, when will our children receive the education that our tax dollars are paying for? Why increase our school taxes if children are not in a classroom being taught by teachers and not a computer? And her other question is, with our children spending less time receiving instructions from actual teachers and more time with their faces in a computer screen, do you think our children will do well in the state mandatory testing? Our children face many challenges daily, but one challenge that I feel is hurting them the most is the emotional and mental effects of this remote learning environment. Do you feel that our children's emotional and mental states are important? If so, what do you plan to do to help these kids? So Dr. Evans, do you want to address any of that now, or do you want to take those individually?
Sure, I can speak to a couple of them, and whatever I can't answer tonight, we'll respond directly to the individual. There is no state mandatory testing this year. That was just announced by the Board of Regents over the past couple of weeks. They're actively pursuing federal relief from any assessments. And if they are required to give assessments, they're not requiring students to take them. So there will be more coming out from our elementary, middle, and high schools regarding what 3 through 8 and the Regents exams look like. But there are no mandated state tests this year. We have put in a, relative to the second question on, yes, we do believe children's emotional and mental states are very important to us. There are a number of social emotional learning strategies and programs that our schools are putting in this year. Advisory times where teachers are making deliberate use of that time. If you look at even some of the remote day schedules, I'm thinking of like RJK Middle School in particular, when they are on a remote schedule, there is a bona fide set aside time where staff members are implementing social emotional supports for students. And then obviously the higher need students in terms of that get it through counselors and social workers and other school staff. So that is our plan on helping our students cope through that. The other questions that she asks, we'll be reporting at, I believe, the next meeting in April on what the tax levy might look like for next year. The state right now, the legislature has put out a fairly robust state aid package, and we've been working hard to keep our costs for next year down, as one can see throughout all these presentations we've been doing. So that's relative to taxes. I'd say tune into the next meeting on taxes. And yes, we do have reopening plans. I just presented them, and I will. There'll be more communications coming home to parents.
Okay, thank you, Dr. Evans. This next information comes from Mary Beth Bestone. When will we be purchasing partitions with the COVID relief funds that the school will be receiving? So Dr. Evans, I believe we already covered that, but do you want to add anything to that?
Yeah, well, COVID relief funds can be used for a number of issues, and we have been using them for a number of issues. One of the ways that we're looking at, right now and just doing some mock-ups of if we were to increase cohort C's in our elementary school, meaning more students attending in person, that would require more personnel to do that. So we can use COVID relief funds to offset those costs. So when it comes down to, do we want to have partitions in, or do we want to have staff in to be able to teach kids? Those are some of the calculations that we make. And we want to be able to bring kids in as safely as possible. And if we have the space without needing the partitions and we can get the staff through those federal funds, then we'll do so. And it's not just staff, it's also cleaning needs, personal protective equipment. And as I mentioned before, we are starting to look at face shields as a possible less expensive alternative. There's a hidden maintenance cost to those partitions, as I mentioned before, where they have to be cleaned daily. So in addition to acquiring them, that cleaning and upkeep is ongoing.
Okay, thank you, Dr. Evans. And just give me a moment because I'm moving through things that are coming up to me as Janet is sending them. And thank you, Ms. Montez, for doing that. Excuse me. Okay, although our monthly I'm sorry, this is from Melissa DeSimone. And this is, although our monthly pandemic meetings for KLR was quite informative yesterday, unfortunately, it is still left open one of the most important questions: when are these petitions being ordered? They seem to be vital to our reopening safely. As you are well aware, the surrounding districts are open 4 to 5 days per week after spring break. Please let me be clear. I am not comparing apples to oranges. Also, I would like to confirm with Mrs. Olermarks, Dr. Olermarks, that the survey is ready to go out. So Dr. Evans, there's pieces of that that have been answered. So is there anything you'd like to address from there?
I'm muted, hold on. I'm just trying to locate that question. So we did mention about the surveys coming out very soon. Again, we spoke about the partitions. Yes, we're very aware, and we've just put out our plan to reopening 4 or 5 days a week. Yeah, so we've answered those.
Okay, thank you. And then the last one that I've got in the file right now is from Victoria LaRusso. And she asked that we please read her questions out loud, which is what we're doing. Just give me a second so I can actually blow this up large enough so I can see it. There we go. The first question is, the governor said we do not need to quarantine after domestic travel. If students travel over spring break, what is the district's policy now today? And then the second question is, it was reported that the CDC will be making an announcement tomorrow for schools to change the social distancing policy from 6 to 3 feet. What will the school do when this announcement is made to get our kids back, and how long will it take? Thank you, Victoria LaRusso. Dr. Evans?
Sure, I'm going to defer the first question to Dr. Oler-Marks in a second, but I'll answer the second question first about the CDC possibly reducing social distancing from 6 feet to 3 feet. The first thing we're going to do is read what that policy recommendation says. And then the second thing we'll be doing is measuring out 3 feet. We did think about earlier in the week, when do we start measuring 3 feet? We knew this was on the horizon. We heard last weekend that Dr. Anthony Fauci had mentioned that they were reviewing this. However, until we actually get the order, we have enough on our plates presently to keep our schools open, functioning, and clean to begin measuring what 3 feet might look like. So we are prepared to do that, though, if that order goes out. Relative to the spring break travel, we are aware of what the governor stated. However, what the governor states does not always translate into the actual regulations that go into place from the Department of Health. So we are aware that he mentioned that at a press conference. The current Department of Health guidelines are that vaccinated individuals, which probably won't be very many students at all because students are not getting vaccinated. Vaccinated individuals, if they are between after day 14 of their second dose and before day 90 after that second dose, they can travel to non-contiguous states and return without any type of quarantine, provided that they are not symptomatic. For non-vaccinated individuals, if they travel to non-contiguous states, there is a testing cycle where they have to test 3 days before they return, then self-quarantine, and then test again 4 days after they get back. And if those are both negative, then they can return. Now, that's what's in writing today. We know that the governor made a statement on that, but we haven't seen that actually translated into Department of Health regulations, unless Dr. Oler-Marks, you have seen something that I'm not aware of.
I have not, and according to the conversations I've had with the Department of Public Health, we should follow the regulations. The only other thing I would add to that is that the other group of people who are exempt from the quarantine are those that have had COVID and have had an antigen test that they can produce.
Okay, Ms. Sharaff.
So Dr. Evans, this is all based on honest self-reporting, right?
Very often it is, yes.
Yeah.
So, Ms. Doherty.
As going back to the couple of things, actually, going back to the partitions, was I to understand that some of them would be, they could pick them up and take them with them? Okay, and
Yes.
then
Yep.
how big are they?
Depends. Some are like tabletop, some are floor.
Uh-huh. Okay.
Different models out there.
As a mom of boys, I would want to have a further discussion of any liability issues that would go along with giving them shields, literal shields. Okay. So as in, you know, that would
They
be,
come with swords.
yeah, I would have to, that would definitely have to be some more discussions as it pertains to liability if we were to move forward with that. However, I just want some clarification for myself as well, because I think that there's some kind of narrative that's getting misconstrued as far as that goes. Just for the record, my personal ideology would be that the school would be open every day. And I'm not so big on a lot of these, other than there's no science behind the 6 foot. You know where the 6 foot sign separation came from, was from 100 years ago. So there's that's why they're updating that now, but neither here nor there. And without having, you shouldn't believe me. You'd have to want me to cite a source. With that said, am I to understand that we as a school board, you as our chief executive, have a certain amount, a parameter of a formula, if you will, that you have to fit in order for us to receive the funding and to be in compliance, correct? You have to follow these rules that are set out by the Department of Health and by the state that are given so that you make these decisions. This is not based on our personal ideology or what we may feel or not feel. We only have a certain amount of room to work within these factors, correct?
Yes, and when a school district strays from recommendations from the Department of Health,
Correct.
or the state education department, and maybe the CDC doesn't have direct regulatory authority, but it does provide guidance. There's a risk in that, and risks on a number of levels, not only for individuals' health and well-beings, but litigation risks as well for the district. So
Right.
that, all of those things are concerns to me, paramount
No.
student and staff health. So
Right. And as for somebody that does actually feel, that doesn't take myself personally, doesn't believe, I don't want to say doesn't believe, but I have a different research that I found that I don't necessarily agree with personally, but acting as a board member of one of 9, I understand that there are certain things that we have to comply with. And I just wanted that to be understood, that it's not that we're trying to keep like I said, I personally think that we should go 5 days a week, but I understand the risks and all the other things that we have to comply. So it's a very difficult balancing. And I just wanted to be sure that I'm reading it correctly, or communicating that to my constituents who do seek to me personally correctly. That's all.
you are. Thank you, Ms. Doherty.
Thank you.
Thank you. That was a very good clarification of that information. So I am going to Dr. Evans in the second portion of public comment. There are a few more that were uploaded so that we could read them a little more easily from Janet for us to see. So I'm going to continue on there because I know that you've been trying to see where they are as well. So this comes from Kelly Van Kaufman. And her question is, hello, there are multiple Orange County K-5 schools that are opening up 5 days. What is the reason our K-5 schools have no 5-day opening plan? What are the differences between Orange County Department of Health rationale and the Sullivan County Department of Health rationale? Thank you, Kelly. So Dr. Evans.
I can't speak to the differences between public health. I won't, venture into that, how Orange County Department of Health reads something compared to Sullivan County Public Health. That's not my place. The other questions relative to our 5-day opening plans, I just presented them. I'd be happy to send them on to Ms. Vaughn Kaufman as well.
Okay, thank you. This next one comes from Melissa Renee Benjamin. And I'm going to grab another swig one more time. Excuse me. My question is in regard to the before and after school programs not running. Isn't this program funded by a grant? Where is the grant money and what is it being used for now? What is the holdup in getting the program running? Is it a space concern, janitorial concerns, staffing concerns? There is conflicting information as to why it is not running, and there are many families like my own who are suffering because these programs are not running. I am not simply inconvenienced. My child is unable to attend school and receive the things outlined in her IEP plan. I've got to skip this part, I'm sorry, because it refers to your daughter specifically, or your child. I don't know if it's a daughter based on how this is written. I apologize. We are really not getting any answers as we watch our children fall farther and farther behind. The grant was obtained because there is a strong need in the community. Our community is suffering. Families are suffering. Our children are suffering. When will we start to get answers about the program and many other concerns? Please understand, Ms. Benjamin, I did take out the section regarding your child once I started to read in that area because we, based on policy, we can't read that, but I did read the rest of your comment. Dr. Evans?
So I would like to defer this for a larger explanation at the next meeting under correspondence because there's a lot going on here. I can give a few brief things relative to, yes, there are staffing concerns in terms of finding appropriate staff and people who are willing to work those hours after a pretty stressful day as it is under COVID. The grant has changed the rules a bit that now require at least 3 hours of programming outside of the school day, which also is a bit of a challenge under this this current situation. And lastly, they've put in some other challenges with how schools would be reimbursed for funding, in that they're basing that funding now on students who actually attend for those 3 hours, and then the district would get reimbursed afterwards. So it would be entirely possible that we would put a staff member, teacher, paraprofessional in that room after school for 3 hours, and we wouldn't have enough students turn out to fully pay for that student, that staff member's reimbursement. So we would be then spending that out of the district general fund, which it's not budgeted for in our general fund. It's budgeted through this grant. We will have a more detailed response from Ms. Benjamin that will be included in correspondence at the next meeting.
Thank you very much. And again, anybody who's seeking that answer will be able to read it because again, we'll upload anything that we can't answer here. And then this last one that I have that I can see at this point is, and I'm sorry, I'm going to butcher this name and I apologize, Nicole Casamasima, I think is how it's pronounced. So I apologize if I mispronounced it. The question is, no increase of social work. Certainly there will be an increase in social emotional needs of students as a result of the upheaval caused by the pandemic. I am assuming that this is referring to the budget presentation that was done this evening. And that can just be a consideration maybe brought to the attention of Ms. Duryea to see if she believes that there's enough funding there, but she's got support for potential additional funding in the makeup of the budget. Dr. Evans, did you want to add anything to that?
That doesn't always translate into personnel, right? It's also about programs and how we reallocate existing personnel to implement what are effective programs for student social emotional learning. So we believe right now that we have enough staff to be able to pull it off. However, as federal stimulus monies become available, if we recognize an increased need, which there could be, we believe that we can use those stimulus monies to help fund additional positions in counseling.
Okay, thank you very much. Thank you very much for your help with this as well, Ms. Montez. We appreciate it. Moving on to 01, Superintendent's update. Dr. Evans, back to you.
Thank you. Hello again, everybody. Just a few things. The biggest update I have at this point is relative to the state budget. Last week, the New York State Assembly and New York State Senate adopted what they call one house budget plans for next year. That's the New York State Senate version of next year's budget and the New York State Assembly's version of next year's budget. At some point, those need to be reconciled and with the governor. And as Ms. Fela mentioned, the state is required by law to have an adopted budget for the following year by April 1st. Once the state has an adopted budget, we will know how much state aid we are expected to receive next year. And from that point, we can put the final pieces into our revenues in terms of how much out of our fund balance we might use in next year's budget, or how much the tax levy will be affected in next year's budget. So we're watching that very carefully. I gave the board a kind of detailed analysis from the New York State Council of School Superintendents on point by point, if you're so interested. One thing that I will share publicly is that in both the Assembly version and the Senate version, there is a provision for the building aid forgiveness that our district has been seeking going back the past 10 years. That forgiveness is about $1.9 million. The governor has consistently vetoed standalone bills that have been put forward by Assemblywoman Gunther and before Senator Martucci, Senator Metzger, and I believe Senator Bonasek did too at one point. Other school districts have received that forgiveness. We have not. This year, that is now included in those budget resolutions. So it's a little bit different than a standalone bill. And also both the Assembly version and the Senate version of the budget they're really in complete disagreement with the governor's proposal. They have a 3-year plan to fully fund foundation aid. They also will not be using federal relief monies to supplant the state's commitment for state aid. And they are also not including the STAR reimbursement and then withholding as some type of shell game that the state historically has provided for. However, the governor wants to include in next year's budget. And they've also completely denied the governor's proposal to collapse all of the expense-driven aids into one services aid category. All those bode very well for school districts across the state. But stay tuned.
Thank you very much, Dr. Evans. Moving on to the enrollment. I'm sorry, I'm scrolling back and forth here to get back to where I was. So the enrollment report. Did anyone have questions, by the way, for Dr. Evans? I'm sorry, I was communicating with Janet. Any questions? Okay, and then moving on from there, enrollment report, Dr. Evans.
Yeah, we have a slight uptick for the month of February. I haven't had a chance to compare this with February's past. However, it appears that the enrollment decline that happened throughout the fall and through the winter has stabilized, and we've picked up a couple students, which is a very small change when you're dealing with a population of over 2,700 students.
Okay, any questions around enrollment? Thank you very much. Moving on from there, Assistant Superintendent for Business and Update Information, Ms. Fela.
Good evening. Tonight you have your regular budget status and revenue status, claims auditor report, and school lunch profit and loss for the month of January. The only other item under my report is the Smart Schools Bond Project, asking the board to approve an agreement between CPL and the district for CPL to oversee a company called ECC in the design implementation RFP and all bidding and of the Smart Bond project, to coordinate that with our current capital project. It's a infrastructure kind of project for cameras and swipe card systems and things of that nature.
Okay, thank you very much. Any questions from the board? Moving on from there. Okay, not seeing any. Moving on, Dr. Oler Marks.
Sure, thank you. Good evening again. So you may recall that 2 years ago, we had a shift in the way that we worked through adopting programs at the elementary level, in that we became much more participatory and ensured that the teacher voices were the ones that were leading the process as the experts and those that were implementing the programs. And so we came to the board 2 years ago in 2019 in the spring to present a new ELA program for grades 3 through 5. Last year, we had a very truncated process because of COVID, but we also came to the board last spring for K-2 in ELA. And tonight we're going to have a short presentation on our proposed change for K-5 math. And so I'm going to turn it over to Kim Gordon, who is our Director of Math, Technology, and Social Studies, to introduce our 2 elementary math coaches who will be presenting this evening.
Hello, everyone. So I'm really here just to support Ryan Spear and Jen Rustin. They are elementary math coaches. They've done an absolutely amazing job leading the math task force in the selection of our math curriculum for elementary schools. So I will go ahead and let them present their finding. Ryan and Jen.
Janet, if you could put the presentation up, please.
All right, good evening. As Kim said, I'm Ryan Spear. I'm the 3 through 5 elementary math coach. And I was going to begin with reiterating what, or basically thanking the board and Linda for the change that has taken place over the last 2 years, where the teachers do have a say in the programs that we use to teach. So on behalf of the task force and all the elementary teachers, we just want to thank you for this opportunity. The process for the review of our current math curriculum has taken place over the last 2 school years. Last year in the fall, we put together an elementary math task force that Jen will describe in more detail in the next slide. But that task force began meeting in October of 2019. At our first meeting, we came to an agreement on what it was we were looking for in a new math curriculum. If we were going to adopt something new, what were our priorities? And from there, we created an evaluation rubric. We then brought in 4 different companies to present their program to us. Each program presented for 1 hour. From there, we selected 2 programs that the task force was going to bring in and have teachers. We were using the term audition lessons, but basically just dabble in the program, try out a few lessons, maybe 5 or 10 lessons of each program, and then provide feedback. We had some teachers trained in the 2 programs, and then the pandemic hit last March. So this presentation has been a long time coming, not just tonight, but this should have taken place a year ago. So we took a negative and really turned it into a positive, as opposed to rushing to a decision a year ago with very little experience in the program and basically basing our decision on a sales pitch, because that's what it was. It was their salesmen selling us a product. We asked for the task force to be continued for 1 more year and truly pilot the program. So, and we were given that opportunity. So we brought in Big Ideas, which was one of the programs we looked at, and we are piloting it this year. So Jen will explain who is piloting it. But the task force continued to meet regularly, and we'll pick up on our findings and our work for this year later on in this presentation. So next slide, please.
So as you can tell by this slide, our task force was comprised of a diverse group of teachers based on their role in the district. We had teachers from levels K through 5, all the way from all 3 of the elementary buildings. We included AIS providers as well as special education teachers from both the self-contained environment and the inclusion environment. We also included teachers that had experience teaching ENL, the ENL population, and instructional coaches. And I have to say, some of them are still on watching us live because they wanted to support us, and they're an amazing group of teachers, I have to say that. You can go to the next slide.
So as I mentioned, we came up with a rubric last fall, and one of the things that we were listed as a top priority was that our program that we chose was research-based in sound mathematical practices aligned to the Common Core and next generation standards, and the program that we're presenting tonight is. So we just wanted to mention that it is based in research. You can go to the next slide.
From this slide, you can tell that we had a range of teachers from K all the way up to 5 lit the program. We had self-contained classes as well as inclusion classes, and AIS providers dabbled with the materials. We provided, or the Big Ideas program, the company provided training in the beginning of September, and then we did follow-up sessions throughout the fall and into the winter. And what we did was we differentiated those sessions. So if a person was doing hybrid instruction, they were grouped with hybrid teachers. If a teacher was fully remote, they were with fully remote teachers. And then as well as if you were uncomfortable with the technology and you needed a little more slower pace professional development, we were able to differentiate that as well. You can go to. With evaluating the program, the Math Task Force continued to meet this year to evaluate the program, not just necessarily compare it to programs that we've used in the past. It was really to evaluate based on what they set in the beginning of this process, what they were looking for. They were looking for alignment to the standards, student-centered lessons, and a program that was understandable to all the stakeholders. They surveyed teachers, parents, and students. And as you can tell by the responses, we did pretty good with getting our participation in those surveys. So for the purpose of this presentation, Ryan and I really summarized the points from the results of each of the surveys and picked out what was really most important to everyone in those stakeholder groups. So for the students, we got a lot of response on the instant feedback that they receive using the online platform. So the students felt successful. They also commented a lot, which was important, on the directions and the activities being easy to understand. And they enjoyed the games, the songs, the stories, and the videos that go along with the curriculum. You can go further. As far as the parents, we had an overwhelmingly positive response. They felt that the directions, again, just as the students did, that they were easy to understand. And there on the homework page, there's a QR code on there. So if a parent had a difficult time helping their student, they can use the QR code to do the assignments. One of the quotes that Ryan and I felt was really important to bring up was the one on your slide. My kindergartner can easily follow the teacher and sometimes can do the problems on his own because the pictures can sometimes be self-explanatory. And we chose that one because it's so important to realize, like, kindergartners don't know how to read. So if a parent feels that their kindergartner can do the work on their own, that's super important. You can go to the next slide. There you go.
And we surveyed teachers. As Jen stated, we had 60 responses from teachers who are currently piloting the program. We pulled out some of our notable quotes. We won't read them all to you, but I will highlight some of the comments that some of the teachers have made. The first one being that one of the teachers said that their students are more engaged than ever. And I love the end of that quote where it says, rigor doesn't have to be stressful. As Jen said, we didn't spend the whole time comparing big ideas to what we used to have, but what we used to have was rigorous. I mean, you can't deny that it was. And so is this new program of Big Ideas. It is rigorous, but it's not stressful. And then the third quote, again, as Jen mentioned, it's overwhelmingly positive among parents, where this one teacher reported that this is the first year that she hasn't had parents contacting them explaining that they don't understand how to help their child at home because of the ease of use of the program as well as that QR code. And one of the comments at the bottom, especially in the time that we're in now and all the issues that have been raised even tonight, is that the teachers have the ability to go back to previous grades and rescue skills that may be lacking and make sure that those prerequisites are in place before moving on with the current grade curriculum. And it's easy to navigate the program. Next one. So We ended about 3 or 4 weeks ago. The task force came together and we took a look at all of the data that we had, including surveys, and the committee members are using the program, and we met for quite a while. And as Jen said, we're just presenting this tonight to you guys, but the task force members were incredible over the past year and a half. Incredibly professional, passionate group of people, and all the teachers who stepped up this year to pilot the program, especially in this crazy year to take on a new math program. We're going to throw a new way of teaching and then learn this new math program on top of it. So we really want to thank all those teachers who really stepped up this year and made this part possible with a tremendous amount of positive feedback. The task force met and we came to a consensus. Linda explained this process to me last year when this started, that it's not a vote. We don't want you to vote, and we don't want somebody to bully the other people in the committee to think their way. And it truly was a consensus. It was professional, respectful dialogue amongst the committee. And from all of the data and our conversations, we unanimously are requesting that the board adopt Big Ideas as the K-5 math curriculum beginning in September of 2021. And again, thank you for your time. And if you have any questions.
Are there any questions from the board? So Ms. Sharoff, and then Ms.
What is it replacing?
It is replacing the Eureka Math program, which was part of the Common Core rollout that the state had purchased and made available to school districts.
Thank you.
You're welcome.
Mr. Crumley?
Out of the parents, the students, and the teachers, they were all very positive comments. There had been a couple negative ones. What were they?
We were prepared for that, Tim, because we said, what if they ask about negative comments? So negative comments from kids, it was a very kid-friendly survey that we asked, in kid-friendly, because we asked the same survey to K-5. So it was very kid-friendly. If the kids, I think one of the questions was, what do you like and what don't you like? What don't you like about the program? I don't like multiplication. I don't like division. Well, sorry, kid, you're going to be doing division with no matter what program we pick. So
I don't like feeding the dog. I don't like bringing in wood.
Exactly. So it wasn't the program. It was mathematics that the kids, if they were negative. And the same thing was true for the parents. It wasn't the program. It was this quote new math, and I don't get the new math, and I don't like the new math. And we've been hearing this for 10 years. So it's not the program. It's the mathematics. It's, so really
it's doing it my way and then re-engineering it backwards so I can figure out what you're trying to teach my kid.
Right. But I'll tell you, Tim, one of the best things that we mentioned, it was the QR code. The parents can hover their cell phone over the homework. There's a QR code and it plays a 3 to 5 minute video that helps the parents understand what it is they're doing. Because there's nothing more embarrassing than having a first grader bring home work and you don't know how to help them. And they're in first grade.
And how did you guys?
You may have a master's degree and can't help a 6-year-old with their math homework.
And how do you feel that the company support's going to be with some of that technology-driven aspects of their program over the course of?
Tim, that was my number one question, because as I said, these are companies selling a product. And the program that we're using now has tremendous support, both in PD and technical, and I was skeptical and cynical in the fact that once we adopt the program, then we buy the used car off the lot and we're on our own. So that was my number one question, was what PD and what support will we receive after we fully adopt the program? And they are fully committed. They sent a very well-written, they sent it to Kim, but Kim sent it to us, that is what they pride their company on. And if they maintain the level of support they've been giving us the past year and a half, I think we'll be in a good spot. I mean, I literally now can text one of their people, one of their professional development facilitators, and she'll either respond via text right away or a call or an email. There is going to be embedded professional development with, and Kim can speak to that if she wants to, there's embedded professional development with the adoption where they will do both in-person and virtual PD sessions to train all teachers in the program, many of which have already received training, but we will have follow-up. And then for those who didn't pilot this year, we will provide the initial training for them as well.
Thank you, Mr. Spear.
You're welcome.
Any other questions around the room? Ms. Sheriff?
Parents have been complaining about new math since 1961.
Thank you for that insight. With that said, if there are no other questions around the room, I do want to thank both Ms. Rustin and also Mr. Spear, along with Ms. Gordon being here, and Dr. Ola Marks. Your guidance has been with our curriculum and making those changes that this board has been seeking and having dialogue around for quite some time. It's nice to see those action plans finally coming together, and we appreciate all of your work in making that happen. So anything else from your end, Dr. Ola Marks?
No, just a lot of gratitude for Ryan and Jen and Ryan's perseverance over the last year and a half, 2 years, whatever, to make this be, to get to this point where we're recommending a program. I'm very grateful for the process.
Thank you so much for the thorough work from everybody. Thank you. And moving on from there, Mr. Crumley.
I move that we take action items T1 through T10 as a group.
Do I have a second to that? Made by Ms. Galligan. Any discussion? All in favor? Any opposed? So ordered. Mr. Crumley.
Move that we approve action items T1 through T10 as a group.
Seconded by Ms. Greco. Any discussion? All in favor? Any opposed? So ordered. Moving back to Mr. Crumley.
I move that we, I don't know how exactly I would say it, because if I say approve, it sounds like I'm forcing people to do it.
Approve.
T11 through roll call vote.
So, second to approve that portion of the budget, seconded by Ms. Jersey. Any discussion? Okay, Ms. Montez, you're on.
Okay, for T11.
11. Yep.
Tim Crumley,
Aye.
Kathleen Doherty,
Aye.
Wendy Galligan,
Aye.
Jennifer Holmes,
Aye.
Helen Jersey,
Aye.
Adriana Greco,
Aye.
Lori Oristano James,
Aye.
Stacy Sharoff.
Aye.
Motion approved.
Thank you very much, Mr. Crumley.
I move that we approve action item T12 through roll call vote.
Seconded by Ms. Weiner. Any discussion? Okay, Ms. Montez, you're back on.
Timothy Crumley,
Aye.
Kathleen Doherty,
Aye.
Wendy Galligan,
Aye.
Jennifer Holmes,
Aye.
Helen Jersey,
Aye.
Adriana Greco,
Aye.
Lori Oristano James,
Aye.
and Stacy Sharoff.
Aye.
Motion carried.
Thank you very much. Moving on to correspondence, you see some of the things that have been listed there, et cetera. If you have not taken a look at the Sullivan BOCES Edge, the winter edition, Donna Hemmer does an amazing job with that. She's been doing it in a virtual world for quite some time, and the information there is really quite impressive. So please make sure you take a look at that and see what's going on at BOCES. And kudos again to Donna Hemmer. We as a board appreciate your efforts in getting that information out. Moving on from there, questions and comments from the public. So I am going to read some more into record. So again, from Anne Marie Laux, what happened to all the COVID-19 emergency funds that have been rewarded to the school? And followed up with, why does the school district feel the need to lie to their families about COVID rates? Stop playing games and let our children get back into the classroom and let them get their education just like you got yours. Dr. Evans, I believe that we have answered those questions. And if there needs to be further correspondence with regard to that, you can reach out to that unless you have anything else to add.
No, our data is taken straight from the New York State Department of Health website relative to infection rates.
Mm-hmm. So thank you very much. Moving on. I'm going to butcher her name again, and I apologize, Nicole Casamasima. Will the delays also delay the date of school will start in the fall as it did this year? I'm assuming what she's referring to is to the building project. So Dr. Evans, do you want to address that, or I can address it with regard to the calendar?
The board's already approved a calendar for next year. We don't have intentions at this time to change it. We will be, making whatever alternative plans we have to start at the, the predetermined start date in early September. So the short answer today is no.
Thank you. This next one is again from Melissa Benjamin. This email contains a couple of questions. I understand the constant point being made about not comparing apples to oranges, as many parents have asked why Monticello Central School District is not opening while neighboring districts are finding ways to do it. Isn't it possible that maybe Monticello Central School District can learn from others by looking at what they are doing to carry out opening more in face-to-face time for their students? Has administration reached out to some of these local districts and asked to visit and see how they are achieving this? Isn't there government funding to aid schools, such as stimulus money or funding under the CARES Act, that can be used to help ensure more face-to-face instruction for our students, such as for installing petitions to allow more students in classroom, et cetera? Does Monticello Central School District have access to these funds? Do they have plans to use them to get our children into school for increased face-to-face instruction? Has the district seen the latest CDC information regarding the possibility of reducing social distancing from 6 feet to 3 feet? Thank you all. Thank you to all of the teachers who are working hard for our students every day. Thank you for the many district administrators who continue to work toward getting our children into school for face-to-face learning. Thank you, Melissa Benjamin. So Dr. Evans, I know some of those things have already been answered. I was quickly reading, so I would have to go back and re-scroll if there was. Did you pick up on anything that you want to readdress, or would you like to just address this?
Sure, I can address it now. We appreciate that recognition, and I too appreciate everything that our staff are doing. That is no small lift, and everyone in our schools are doing really hard work right now to keep this thing going. The general answer to all of our questions are yes. One of the things we talked about, which was at the elementary level, possibly collapsing the cohorts A and B and moving students into either cohort C or cohort D, is a common model that is being used in different places throughout the state that we are borrowing from other places. The high school, I know, has been in touch with other high schools around about how they are increasing in-person instruction. So yes, we have been doing that, and people have come to us too with similar questions about how we do things. So yes.
Thank you, Dr. Evans. This question, there's two of them, come from Maria Pappas. Why are we paying teacher salaries with COVID really fun money? I'm not sure what that's referring to. So if I'm not understanding that, Ms. Pappas, if you could please clarify that. That Dr. Evans stated. So I think they're really fund money. Maybe, I'm not sure what that is, but there's more to what she writes. So if you could please clarify that question a little bit more. And Dr. Evans will certainly be able to respond to that. And what does at-risk mean? Why are they first priority? What makes that so? And her last question was, why are we shutting our schools down every time one person has been exposed or tested positive? If you're social distancing and wearing masks, what is the problem? Is this not the point and purpose? So there's two questions in there, Dr. Evans, and the third one, hopefully she's listening and we'll reach out with that.
I can address those latter questions now. At-risk students are at risk of not being successful that school year or subsequent years that follow. And the State Education Department and the New York State Department of Health last summer recommended that districts prioritize at-risk students among different needs groups as priorities in returning to in-person instruction. The latter question is about why do we close schools when we get a case? It's because if there is a critical mass of staff members, either in terms of the number of staff members or the type of staff members who are on that quarantine list, then we cannot successfully or safely reopen schools. So sometimes we hit that threshold. Sometimes it depends on the number. It could be a very limited number, but if it's the critical people of the school, then we have to put that school on remote instruction. Sometimes it could be a larger number of students and staff involved, and we are able to keep school open through some creative scheduling. And I give a lot of credit to our staff who are able to pull that off. So the number, that's why we close the schools. It is not, we deep clean the schools after those cases, but generally speaking, that's why we switched to remote instruction.
Thank you very much, Dr. Evans. And this last question comes from Billie Jean McGinnis. And her question is, if the CDC changes their guidance to 3 feet, does the district need to wait for the governor and local public health to adopt those guidelines before making changes, or can they begin the process after the CDC releases their guidance?
That's an excellent question. It's a question that puzzles us too. If that were to happen, we would be seeking legal guidance on what we can do or not. I believe that the Sullivan County Legislature was considering, among other legislatures around the state, asking the state to reconsider its Department of Health requirements and to get those more in line with CDC guidance if the CDC guidance were reduced to 3 feet. But we'll find out more if and when that happens.
Okay, thank you. And while we're on Billie Jean McGinnis, please send me how I can get my Girl Scout cookies this year, dear. Kayla Colon, I see you have a hand raised.
What is that number of teachers that would, or the number of faculty at all that would shut down the school?
Were you able to understand that, Dr. Evans?
What's the number of teachers or faculty it would take to shut down a school? It depends. It depends on their assignments. It depends on their schedules. It depends on our abilities to cover those assignments for the day. There's been some cases where there's a handful of staff, but they're a critical staff and we've had to shut down. There's been other cases where it's a wide swath of different staff members from different departments. We've been able to stay open. So every case is an individual consideration, and we have a pretty serious internal dialogue with the administration about, can you do this? Can't you do this? What if you were to schedule it this way or that way? So it depends every time.
Okay, thank you, Dr. Evans. Does that answer your question, Kayla? Great. So with that said, at this point, that was what was able to be uploaded to me. Anything else that comes in, as we said, as part of our policy, we will respond accordingly during the time in between the next 2 meetings. We thank people for being here and reaching out to ask us questions. We appreciate that. Moving on from there, we have a motion to adjourn somewhere. Anybody? Made by Ms. Jersey, seconded by Ms. Holmes. On behalf of everybody here at Monticello Central Schools, we very much appreciate you taking an interest in our students and our schools. Everyone have a good night, and always with Monty pride. Thank you. Good night.
Good night, everyone.